39-year-old Jacqueline Joseph traveled from her home in Philippi Region 7 on November 15th to deliver her baby at the Georgetown Public Hospital in the capital city. This is Jacqueline's third child, but it is her first to be delivered with complications. Her village does not have the doctors or medical equipment to help her in this situation.
It was difficult over there. There is no doctor in our interior.
There is any health centers and stuff?
Health center, yes, but they're not really doctors. There's a midwife, but they don't have proper facilities over there.
Where is the health center away from you?
It's in my village, yes, but it's not our village don't have doctor, nurses and so on. Only the midwife.
As such, she had to be flown to Georgetown on a medical evacuation flight, or what can be termed an air ambulance. So every time persons have like pregnancy or anything, they come out?
When they are getting hard time.
Jacqueline delivered her healthy baby girl on November 16th. For her and other patients like herself, the medical evacuation flights are the only hope for persons with critical injuries or illnesses in Guyana's hinterland regions.
Going back into the regions, doing medical evacuation has felt so important for me because I know of the essential services and why it is so critical for our hinterland areas, because the hinterland areas are mostly blessed with the community health workers. Sometimes the community health worker is just there all alone, or a medics, or even just a midwife all alone running the health post. And so medical evacuation means a lot to our people because it's important for people to get treatment in a timely manner.
Nurse Bertha Barjawan is employed by Roraima Airways to escort patients to and from these areas. Being a former resident of Shelton in Region 9, she knows too well the importance of her job. With the onset of the COVID-19 pandemic, Nurse Barjawan, who has been doing this job for a decade, said her job has changed in many ways. She has had to include more sanitization to protect herself and patients, and wear her personal protective equipment on all of her journeys, something which has not only caused discomfort to her, but often scare her patients.
With all the personal protective equipment being worn now, though during COVID times, it drives a further fear for our patients coming out of the hinterland areas because, okay, you know that this is a nurse that is coming out, but then you're not even getting to see whether she's smiling, because I believe nonverbal communication is very important as well for our patients. The hazmat suit, I can tell you, it's pretty hot, but it's very effective in times of this pandemic.
The nurse, who is also a trained midwife, related that after Guyana confirmed its first COVID-19 case in March, and following the report of infiltrating cases from Brazil into the hinterland regions, she was fearful of continuing her job.
At first, when we started off doing medivacs, early when COVID just got up, or when the pandemic just started, yes, there was a fear because, of course, like everybody else, I have a family, I have kids, and then, of course, I have to come back to work here with my colleagues. So I know I must wear my personal protective equipment properly while on these medical evacuation flights, especially when you know, okay, this is an area where we've been having a lot of COVID cases, for example, in Region 1 and in Region 9.
However, with strict COVID-19 guidelines in place, she shares the sheer excitement of having saved a life, especially on her night journeys.
Of course, I do understand the difficulties for the hinterland communities, and I'm happy that, you know, I can give back to the communities. Of course, if we had no medical evacuation, well, then we would begin to lose people. They would die, and this is one of the reasons that we welcome the medical evacuation very much for the hinterland communities.
This joy was shared by one of her pilots, the Director of Operations at Roraima Airways, Leary Barclay.
I will say it is perhaps the greatest form of human service and national service, and it's actually a privilege to be able to do it. When I come back from a night medevac, I feel on top of the world.
A pilot for 20 years, Leary pointed out that his job changed into that of a frontline worker overnight as the movement of people to outlying regions decreased and medical evacuations increased.
Unfortunately for us, we could not afford to stay at home. There are communities in the hinterland that require servicing in order to be able to live. Their only communication with the outside world is that airplane. Their only communication, their only ability to get proper health care in a very big emergency is an airplane coming to get them to bring them back to Georgetown where the good health care is. So unfortunately we didn't have the luxury of staying at home. We had to learn to adapt. We continued to work. But what we saw was a massive change in the type of business that we were doing. So while our passenger flights dropped off tremendously, we started to see flights of a more essential nature. One of the things also we saw were the medical evacuation services and some shifting and the amount of medical evacuation services going up. So we had to deal with the fact that COVID is not going anywhere soon. And that is a tough realization to face.
Leary explained that some of the protocols implemented by the airline include the placement of a barricade between the pilots and the patients. Everyone flying on the aircraft are now sanitized several times from departure of the Eugene F. Carey International Airport to the hinterland and back.
And one of the areas we had to adapt even more to was medevac flights, and to a lesser extent passenger flights. So in that case, we had to figure out a way to ensure that we did not share the same air with our passengers because we're constantly out there all the time. And with medevacs now, our contention is in the absence of a COVID test that says negative, all of our medevac patients are of course COVID positive. We check temperatures. People are being, you saw earlier, people are being sanitized when they land before they leave the aircraft. Whenever they attempt to embark the aircraft, wherever they're going from, they're also sanitized. I endure a constant being sprayed down with sanitizer multiple times a day. So much so that I have actually enacted that in my own home. People entering cars and entering the home because it keeps you safe.
These protocols are also implemented for passengers and cargo traveling to regions 1, 7, 8, and 9. To date, Guyana has confirmed over 4,800 cases of COVID-19. As of November 16th, 808 cases were confirmed in Region 1, 415 in Region 7, 158 in Region 8, and 376 in Region 7. Guyana has recorded 140 COVID-19 related deaths up to November 17th. Bibi Katoon reporting for the newsroom.